But there's a sugar high that you never see every moment. God, it is breaking me, and with every bit, life is lost in me. But it takes lives every night, diabetes, burning time. Every 9 seconds, someone dies, and by the time I say this sentence, another life is already gone. Hi everybody, I'm Dr. Mehrnaz, a dentist, and let's dive into a shocking fact, the hidden connection between diabetes and your teeth. According to the International Diabetes Federation, in 2024, around 3.4 million deaths happened because of diabetes or its complications. Now imagine this. In your body, there is as much sugar as 12 full spoons dissolved in every single liter of blood. That's exactly what happens in diabetes. According to the International Diabetes Federation, by 2025, almost 589 million adults worldwide will be living with diabetes, and it's predicted that by 2050, this number will rise to 853 million. That means about 1 in 9 adults has diabetes, and the crazy part is many of them don't even know they have it. Most of the time, we think diabetes is just about blood sugar and insulin, but the truth is diabetes affects your whole body, your eyes, your kidneys, your heart, and yes, even your teeth. Diabetes isn't a lonely disease, it's systemic. It sneaks into every single part of your body. Think of our body like a car, it needs fuel. The fuel for our body is glucose. Glucose is the main source of energy for our cells, just like gasoline for a car. Glucose enters your bloodstream and powers up your muscles, your brain, and your heart. But your body can't just let glucose float around uncontrolled. It uses insulin to manage it. Insulin is like a key that unlocks your cells so glucose can get in. But what happens if this process doesn't work? Diabetes happens. Either your body doesn't make enough insulin or your cells stop recognizing it. Types of diabetes. Type 1, which starts in childhood or teenage years and shows symptoms very fast, and the treatment is daily insulin plus a healthy diet and exercise. And type 2, which is mostly lifestyle related, lack of exercise, being overweight, and eating too much fat and sugar. This type can stay hidden for years. Treatment is first lifestyle changes like better diet, more exercise, and losing weight, and if that's not enough, medications like metformin are prescribed. But wait, do you think diabetes just raises blood sugar? Nope. Here's where your teeth become the victims. When blood sugar is high, the extra glucose spills into your saliva. That's like giving bacteria in your mouth all-you-can-eat buffet. They grow faster, attack your enamel, and cause cavities, so your teeth and gums become one of the most vulnerable parts of your body. High blood sugar also increases gum inflammation that can lead to something more serious, periodontitis, a severe condition that destroys the bone around your teeth and can even make them loose or fall out. And here's the worst part. It's a two-way relationship. High blood sugar damages your gums, and gum disease makes it harder to control blood sugar. A vicious cycle. That's why dentists say treating gum disease in diabetics can actually help improve blood sugar control. Diabetes also affects your saliva. It decreases it. And saliva is super important because it washes your mouth and protects your teeth. Less saliva means a dry mouth, which means more cavities and infections. That's why people with diabetes should always drink more water and keep their mouth moist. And let's say that, but there's a sugar high that you never see every moment. God, it is breaking me, and with every beat, life is lost in me. But it takes lives every night, diabetes, burning time. The body of a diabetic person fights infection much weaker. That means wounds like mouth sores or after tooth extractions take way longer to heal. Imagine a healthy person heals in 3 or 4 days, but for diabetic, it could take 2 weeks. And every extra day the wound stays open is like an open door for infection. So, for diabetic, what looks like just a small wound to others could actually turn into a huge crisis. That's why prevention matters so much. Better oral care can save you from even needing tooth extractions or implants in the first place. Overall, people with diabetes are twice as likely to suffer from gum inflammation, tooth decay, fungal infection, dry mouth, and tooth loss. Because if these oral problems aren't controlled, they can seriously destroy your quality of life. Imagine not being able to chew properly, bleeding gums all the time, or losing teeth one by one, all because blood sugar wasn't managed. Now here's a common question. Should someone with diabetes fast before going to the dentist? Of course not, that's a mistake. If you have diabetes, you need to eat and take your medications as usual. Just make sure your blood sugar is under 200 before your appointment. And always let your dentist know you have diabetes. If you go in while fasting, your blood sugar can crash during the dental procedure, and the dentist would have to stop the treatment. Another thing I usually hear is that we cannot get implant because of diabetes. That's wrong. Diabetics can get implants, but under specific conditions. Usually, the dentist will request an HbA1c test. And what is HbA1c? It's a lab test that shows your average blood sugar levels over the past 2 or 3 months. Normal is below 5.7%, diabetes is 6.5 or higher. For dental treatment like implants, dentists want it under 7. If it's higher, the risk of infection and slow healing goes up. And the dentist will ask you to first get your sugar under control. After the implant, there are special care steps. Drink enough water, avoid smoking, take antibiotics and mouthwash to reduce infection, schedule procedures at times when your blood sugar is most stable, usually early morning, and of course, coordinate your medication and insulin with your dentist. With careful diabetes control and the right care, diabetics can actually get results just as good as non-diabetics. It just requires more patience and discipline. And about smoking, I should say that smoking is terrible for everyone, but for diabetics, it's a nightmare. It makes blood sugar harder to control, slows healing, and during dental treatment, it massively increases the risk of infection and treatment failure. So remember, diabetes isn't just about blood sugar. It impacts your teeth too. If you have diabetes, here's what you need to do. Brush and floss every day, visit your dentist regularly, control your diet, drink plenty of water, and always keep your blood sugar under control. Bottom line, taking care of your teeth means taking care of your whole body.